A special interview with the ambassador for the the Republic of Cuba, right here in St. Kitts and Nevis, Ambassador David Rivero. Ambassador, welcome.
Thank you so much, Mr. Huey, for this opportunity to be here with you and talk about Cuba.
Yes, indeed. Cuba has been in the news a lot lately, so we're going to be talking about the current issues. But I also want to start about at least looking at the diplomatic ties that St. Kitts and Nevis has with Cuba. Has been quite some time, at least 3 decades.
Yes. It is exactly. Actually, we are turning 30 years exactly on May 10. Will be the 30th anniversary of our diplomatic relation. The relation were established in 1995, and immediately at the end of the 90s, we start to collaborate together in different projects of collaboration. As you know, the healthcare attentions, the issue with the some young men and women from St. Kitts and Nevis who start to travel to Cuba to receive studies, university studies, and we can talk about from that we can talk about a lot of cooperation and history.
Yes, a lot for the 30 years. What has been in the news a lot lately, more specifically coming out of the U.S., where the U.S. government has essentially threatened sanctions against countries that have the medical program that comes out of Cuba. Now, St. Kitts and Nevis has, the Cuban medical program, or it's called the Medical Brigade, has been in the news a lot lately. We know St. Kitts and Nevis is one of the countries that has this program. Could you just give us some insights into how this program works? Because I'm not sure if everyone truly understands how the program works, specifically for St. Kitts and Nevis.
Yeah, I think before to talk about specifically St. Kitts and Nevis, I may speak about the history of the Cuban Medical Corporation. As you said, we used to name Cuban Medical Brigades. The member chief of this brigade are doctors, nurses, engineers in the health sector, like biomedical engineers, specialists in radiology, in case of bachelors. So there is a big amount of specialties that used to cooperate in different countries. The first brigade who was sent for the revolutionary government was in 1960. The first brigade was sent to Algeria. At that time, the independence war in Algeria, we support with a brigade of 50 members. That was our first brigade in the history. In the 70s, in the 80s, we sent another brigades to other countries like Angola, like Ethiopia, and even in Central America. I remember Nicaragua. In the 90s, the Cuban government designed a new modality of collaboration. The first modalities that I was talking was talking about solidarity with these people, totally free of cost. And in the 90s, we present big programs that send to groups of different doctors who work, like we name the integral program of health, like a package, where several doctors going to work directly with the families in the prevention, vaccination programs. Very useful for those countries. Our doctors, I have to say, it's not the case of St. Kitts because it's a small island, but I have to say that our doctors go to those places where the local doctors are not in condition to go. Our doctors used to work in the jungle, in Brazil, in Venezuela, in high mountains, and provide health care for a lot of persons who have not the possibility to obtain medical attention for another ways. I have to name also, in 2003 was created also the miracle operation. I don't know if you remember, through this program, a lot of people, thousands of people of Latin America and the Caribbean and other parts of the world received free surgical attention for the site. And that program was between Cuba, Venezuela, and I can tell you, for example, here in St. Kitts, 705 persons had a surgery, and other received other treatment, not necessarily the operation. So in 2005 was created the brigade Henry Reeves. The Henry Reeves. That brigade was specifically to help in case of natural disaster, like hurricanes, like earthquake. I remember our doctors and nurses working in Pakistan, in Haiti with you remember the earthquake in Haiti,
right.
In Central America during George and Mitch hurricane, working to help to recover to the people. So it's very, very, very humble program that was created. And the most recent presence of the Henry Reeves Brigade was during the COVID pandemic. Cuba sent 54 medical brigades only to try to help the government, the countries, to stop the spread of the pandemic.
Yes.
Here in St. Kitts, one brigade, apart from the normal one that we have, one brigade of 34 persons traveled to St. Kitts. They were working here for almost a year. And was a successful mission because they helped to stop the spread of the pandemic here in the island.
Right.
Currently, we have a medical brigade for 17 professionals.
And these are nurses and doctors?
Yeah, there are 11 doctors. There are 12 here in St. Kitts and 5 in Nevis. In total, 11 doctors, but most of them are specialists. And there are 2 biomedical engineers, and there are 1 specialist in imaginology, the one who deal with the X-ray and mammograms in Nevis. And I can tell you that it's very important to have here the presence of specialists. This is one of our achievements here in the island, is to have the possibility to provide the specialties that the country don't have this human resource right now, and they ask to the government of Cuba to see the possibility to bring specialists. Of course, depending of if we are available or not, we do that. I have to say that there is historically we work through one agreement between the government, the Ministry of Health of St. Kitts and the Ministry of Health of Cuba. Through this agreement is official. Yes. Our cooperation. And yes, this is what I can say right now in healthcare. I can mention that we have here specialists like neurologists, the doctor who deal with the head and strokes. We have anesthesiologists. We have vascular surgeon. There is obstetrician and gynecologist. There is a epidemiologist, the one who deal with the pandemic and the epidemic here in the country to monitoration of this virus or everything. Right. We have also, I'm trying to remember all of them.
Quite a lot.
Yeah, quite a lot. We have internal medicine, two of them here in St. Kitts and 1 in Nevis. I already mentioned the anesthesia. We have 2 doctors of anesthesia, but at the same time we have a nurse specialist in anesthesia also. As you can see, there are difficult specialties who are very important because otherwise you have to travel to other country to receive treatment for this specialist because you don't have in the country.
Yeah. How does the program work in terms of the rotation of doctors? Because from what I understand, the doctors are not here indefinitely. They're here for a period of time, and then they would leave, or they could have their stay extended. So how does it work?
The doctor they sign an agreement directly with the Ministry of Health, but in our agreement says that the doctor come here for 3 or 4 years. If it's interest of the doctor to be here more than 4 years, we try to guarantee a replacement. No, and that is how it works. The brigade today is not the same like 4 years or 20 years ago. No,
right. So the doctors would have come here in 2020 during the pandemic are not the same doctors that are here.
No, exactly. No. They are the brigade. When I came here in 2021, it's nothing to do with the current that we have today.
And in terms of, because we've heard allegations from the United States that the Cuban medical program is exploitative labor, and they're basically alleging that it's a form of human trafficking, etc. How are the doctors here in particular? How are they paid? How does the labor process work for them?
I can tell you the same that the leaders of this country have saying in their statements. Doctors here have the same contract that have a local doctor, the same condition. Actually, I can say that more because they receive I receive accommodation. They receive salaries, same rates that a local doctor. They have the right to travel on vacation every year. They move free. They hold their passport. So honestly, we cannot deny that this is a mechanism of oppression that only is following to damage the good relation that we have with the Caribbean historically.
Yeah. So in light of all that and the discussions that are happening internationally, where do you see the Cuban medical program, or the medical brigade as we call it, for the region, for the Caribbean, in terms of Cuba continuing this program with the Caribbean countries in light of all that's happened so far internationally?
In my opinion, I think that, first of all, I have to tell you that the will of the government of Cuba is not going to change. Even in our most difficult situation, we have as a principle to maintain the collaboration with our sister nations. As I repeat, it's nothing new, something that have 30, 40 years in some cases. So we are going to continue providing a doctors, depend of course the interest at the request of our sister nation, and the program, the will of the government to maintain the program. Of course, the situation every day is more complicated because there is an element that is that the blockade imposed by the government of the United States to Cuba, that this blockade impact in every single sector of the Cuban people, in the economy, in the health, so in education, everything. That's why we have the idea to keep this program as a mechanism of integration, to maintain this good relation. This is an idea of our leader, Fidel Castro. Actually, the idea of Fidel was we have to help our neighbors, not only in the Caribbean, Latin America, and other part of the world, and also we have the opportunity to the young person go to Cuba to study. because in the future they can have our own specialist and doctor, and at that time, at that moment, so maybe we don't have to send here 10 or 15 specialists, only send 5 because you think it's an EVs already have.
Right, because they already have
10.
specialists who were trained in Cuba.
Actually, there are many, I can name many doctors who works in GNF and Alexandria Hospital. They are graduated from Cuba. I'm very good friend of Cuba. I have to say that here in St. Kitts, there is a movement of solidarity with Cuba. There are organizations of solidarity. I can mention the St. Kitts and Nevis Cuba Friendship Association, very active, always working together. I can mention the Cuban Alumni Association. The membership there is people who graduate and studied in Cuba. Actually, the Prime Minister who studied in Cuba is an active member. Every time he has the possibility, his schedule allowed to participate, he participates with us in these activities. And we have also a Cuban Resident Association, very active with us.
Yeah. In addition to the number of doctors that we have, you also have information in terms of how the work, in terms of how many patients and how many operations and stuff would have been done.
Yes, I found this important information and I wanted to share with you yesterday. So I can tell you, for example, in our historical medical corporation, the Cuban doctors and nurses, I always have to mention the nurses. They are not only doctors, they are a lot of nurses, men and women. So I can tell you, for example, the Cuban doctor in the history have made more than 70 millions of surgical interventions
around the world.
Assist more than 5 million of births of birds. We have a statistic about how many lives our doctors save, and I can tell you that more than 12 million of lives have been saved for our doctor. Here in St. Kitts, I can tell you, for example, in the statistic that we have in our register, here in St. Kitts, our doctor have made medical consultation to near to 600,000 persons. Our doctor here in St. Kitts have made near to 14,000 surgical, including 705 of miracle operation, the site intervention that was between 2005 and 2006. That was totally free.
Yeah.
The people subscribe, submit the form and travel to Cuba. I have met many people. I had a brain surgery in Cuba.
Yeah.
Of course, very happy. So those also we have support with the vaccination of people here in St. Kitts, around 30,000 vaccination with our nurses. Yeah. So there are important data that explain the presence of Cuba here in St. Kitts.
Okay. This has been going on for quite a number of years, and as you pointed out, quite a number of doctors that are trained doctors.
Well, not only doctors.
Yes, are trained in Cuba. Talk to us about this program and why Cuba felt the need to continue this program, to maintain this culture program, not only here, but right across the Caribbean as well.
Mr. Hugh, is not only in the Caribbean. It is in Africa, in Asia, in Latin America. All students who had the opportunity or have the opportunity to study in Cuba, in their classroom, they have one student from Togo, one from Sri Lanka, one from St. Lucia, and that was ideas, our Commander-in-Chief Fidel Castro, to help the countries to have their own professional. If we can contribute with that, totally free, because it is totally free. In the future, you will see the good results. You can see here. I am very proud of that, because if you go to GNF, you find a lot of doctors who studied in Cuba. If you go to SCELEC, you will find 1, 2, 3 engineers who studied in Cuba. If you go to, I don't know right now, a Public Works Ministry, you will find an architect or one engineer who studied in Cuba. So this is a dream comes true, to see how we help to, or how we contribute for the development of the country.
Yes.
About the scholarship program,
yes,
the will of the government is to maintain this program. Actually, in the summit, Cuba, CARICOM, the government of Cuba, the president of Cuba, Miguel Díaz-Canel, he offered to increase the number of scholarships. Even in our current circumstances, we are providing more capacities. This year we offered 19 scholarships.
Yes.
Medical specialties, also non-medical careers, nurses. So the young people of the kids and needs every year, they continue to opting for these scholarships. And in Cuba today we have near 30 students studying there in different parts of the country.
Earlier we talked about the diplomatic ties that Cuba has with St. Kitts and Nevis, which will be 30 years in this coming May. But you also made reference to the challenges that Cuba faces in terms of the sanctions and what the sanctions are for 60 years. How do you envision Cuba maintaining its relationship, its good relationships with its Caribbean neighbors, while still dealing with the challenges that the blockade has brought on the country?
Every year in the United Nations, specifically in the high-level segment of the United Nations General Assembly, the head of every single delegation of the Caribbean, they express to the world their support to Cuba in our battle against the American blockade imposed to Cuba. Actually, in the last year, the Caribbean nation also have expressed their against are the inclusion of Cuba in the list of countries sponsor of terrorism.
Right.
That is a mechanism of pressure, because Cuba has nothing to do with terrorism. But it is a mechanism that is imposed because those countries on that list has problem to normal trade, to deal with financial, to receive funds from agencies or countries. The countries or enterprises, companies who deal with Cuba, they can receive penalties. Any financial operation doing through the banks, there is a persecution of that, and they ban the banks or the companies for this relation. So for us, it's very difficult to obtain good results economically speaking. And as I mentioned, the blockade impacting every single sector of the society. In the healthcare, it's impossible for example, to buy medicines. In foods, for example, sometimes it's difficult to get foods or any single good. So you can imagine, but we receive the support of the Caribbean.
Yeah.
The leaders of the Caribbean are always with us. In the recent situation that you were explaining about the visas, you see how the Caribbean leaders immediately they are explaining that have nothing to do with that things that they are trying to demonstrate.
Yeah.
So.
In the coming years, what does Cuba envision for itself in the Caribbean, especially when it pertains to regional cooperation? Earlier you spoke about, in some instances, maybe expansion of the program, the medical brigade program. But where do you see Cuba's relationship with the Caribbean in the few years from now going?
I think that we have to work also in diversify the program of cooperation.
Yes.
Healthcare is, of course, a sensitive issue because we are talking about the life of the person, no? But we have present in the Caribbean in other sectors. I can mention the construction. For example, we have brigade of engineers and architects working in the Caribbean. Not now, for the last 40 years. We have technical assistance in agriculture. We have cultural exchange, music, the plastic, many things. And here in St. Kitts, we can work. We are open to continue or to diversify this relation.
Right.
Apart from the traditional healthcare cooperation and education and the construction that we have here, engineers, we have here 3 engineers and 1 architect working here in the Ministry of Public Works. Apart from this, we are open to expand in another fields. It depends, of course, the request of the government, no?
Right. So it's really up to the government then to say to Cuba.
Yeah. We can offer, but it depends of the every. My work is to try to see and find the possibilities, and we're doing fine.
Yes.
As well, I was mentioned that. In the future, we would like a Cuba without a blockade. So, can you imagine how many things we can do is if we don't have these measures against our economy? Yeah. So, how much more we can help our sister nation as a mechanism of integration based on the principles of solidarity, of friendship, love, and I repeat, is an idea of the leader of our revolution, and nothing to do with another terms that maybe I use in like medical diplomacy or something like that.
Right.
It's more like solidarity with the same solidarity that we receive from our sister nation. We can also to give solidarity through all these programs.
Yeah. Finally, how important, one message rather would you have for the St. Kitts Nevis public, especially considering that we are approaching 30 years of diplomatic ties between the Federation of St. Kitts Nevis and the Republic of Cuba?
The message is that we are going to continue to remain close to the people of St. Kitts and Nevis. Our program will be here. There is not any single change of that. Actually, we want to do more. We want to, for example, in the future, we would like to explore in trade. Maybe we can see what products we can import from Cuba or from St. Kitts and Nevis. Establish a strong relation and diversify. The message is that Cuba continue here. We have embassy here for the last 25 years. So we are open on every single person who have an idea of what can do to do the relation between both countries stronger.
Yes.
This is the measure. If we can do more, we are going to do. I can assure you that.
All right. And Ambassador, I want to tell you thanks for the time, for taking time to speak with us on these very important issues, and we do look forward to see what the relationship between Cuba and St. Kitts and Nevis has in the future.
Thank you for this again, for this opportunity, and I hope this is not the last time. We can continue talking in another moment.
Yes, indeed. And thank you, the viewers, for watching this special interview here on SK News 9. Our guest was the Ambassador of the Republic of Cuba here in St. Kitts and Nevis, Ambassador David Rivero. Thank you once again, and stay tuned for more.